I'm going to talk about the Affordable Health Care Act and why it was a fraud and a disaster. I was always suspicious. The big suspicion that I had is that when the government regulates business, the business usually refuses to be regulated, and they usually say, we don't want this. It's either good for people or it's good for business. You were pitched that the Affordable Health Care Act was good for people, but none of the businesses complained. The Affordable Health Care Act benefited businesses. People were being forced to buy more health insurance. What does that tell you? There's a profit motive behind this. And so nobody was objecting to this from the business world, and it's supposed to be against them. There's something wrong. The second indicator was that there was an email that surfaced from the White House where it was some sort of a deal. Someone said, and I believe it might have been with Barack Obama, that they would not allow Americans to buy cheaper prescription drugs from Canada. When I heard that, I said, okay, this is a sign that this is a fraud. If the Affordable Health Care Act is supposed to be about affordable health care, then why are you preventing people from buying more affordable prescription drugs? Because it's not an Affordable Health Care Act. The Affordable Health Care Act has a name that is different than what the Act is. The Act is primarily taxes and spending money on all sorts of different things. It's a spending bill, it's a taxation bill, and it's something to get you to spend money, which means it's not affordable. And they said, okay, well, you can keep your existing doctor, you can keep your existing plan if you have a precondition. This was one of the big lies about the Affordable Health Care Act. They said, well, if you have a precondition, you can't be denied coverage. Sounds like a good idea. But the fact is, you are worse off if you have a precondition under the Affordable Health Care Act than if you were not under the Affordable Health Care Act. If you are not under the Affordable Health Care Act and you have a precondition, you'll be denied coverage. You will not pay for coverage, you will not receive coverage, and you will not receive health care. Under the Affordable Health Care Act, you can't be denied coverage. You will pay for the coverage, but you can be denied the health care by something that they call the death panel, which were not doctors, but a group of like 7 people that were appointed by politicians. The Republicans refused to make their appointment. That was something famous that happened. So you could pay for coverage for a condition that you have. This panel could deny you the treatment, which means that you are worse off because you're not getting the treatment and you're paying for it. So that's the catch-22. What they did was they took something that you knew about healthcare that you didn't like, the pre-existing lack of coverage for pre-existing coverage, the lack of coverage for pre-existing conditions, and they gave you something that you didn't understand, which wasn't better for you. That's what they did. Now, there's another problem that's a huge flaw. Everyone has an exemption from the Affordable Health Care Act. Anyone who doesn't want to participate can back out. You look up the list of exemptions. You look them up on your own. I did the research on my own. You got to be a big boy and look it up on your own. There's a list of exemptions. People know about the famous ones, like if you live in a certain state, or Walmart can manage their healthcare program, but no one else can. They get an exemption. Or Nancy Pelosi's flower shop can manage their own, so they get an exception. These are facts. So, what was I going to say? Okay, the exemptions. There are exemptions which mean that you're exempt for the whole year if you meet one of these conditions. And these conditions are something that everybody can do. One of them is a relative dies. My father died the first year. I had an exemption. Another one is you have existing medical bills. You just don't pay your medical bills. You don't pay your medical bills. You don't have to comply with the Affordable Health Care Act for the rest of your life. Or like if you owe bills and you're paying for 5 years, you're not going to pay for 5 years. You don't have to participate. Another one is if you have a disconnect notice for a utility such as water or electricity or gas. Guess what? Don't pay your electric bill for 1 month, get the disconnect notice. They're not going to disconnect you, pay the bill, and you don't have to participate in the Affordable Health Care Act. There were other conditions. I don't remember what they are. One of them might have been losing your job, foreclosing on a house. They had other conditions. So everybody has a way out. That's one of the flaws. I'm a computer programmer. I'm a website developer. My specialty is e-commerce, price comparison, for example. The Obamacare websites are price comparison websites like cheaptickets.com, Orbitz.com, Priceline.com. That's the type of site they are. There's one for every state. Priceline does not have one website for every state. Cheaptickets.com does not have one website for every state. No price comparison website does. The Obamacare sites do. And they spent crazy amounts of money. Billions of dollars, hundreds of millions of dollars. I think it was $50 million for one state. So that each state could develop their own site. It's a huge waste of money. It doesn't cost that much money to develop this type of a site. You don't need thousands of people. You only need one programmer and one front-end developer, and you can develop this site. One person can actually do it. And one person's salary is going to be like $150,000 a year for a good programmer. And I know because I've developed these products and I've done it. I know how to do it. So you don't need 50 different websites, but that's what they did, and it was a complete waste of money. And then they have the federal site and the state sites. Why didn't everybody just use the federal site and get rid of all the state sites? It would have saved so much money. They could have done that, but they didn't. It was a waste of money. Why does the Affordable Health Care Act waste hundreds of millions of dollars? I'm sure that it was billions of dollars. Why did they do that? It's fraudulent. The individual mandate you can read about on your own. The thing that pisses me off, I am a victim of the individual mandate. Basically, it means that if I don't want health care, I still have to pay for it, even if I can't afford it. And what I did was I paid the fine because it wasn't a lot of money. It was cheaper to just pay the fine. And now we got the exemption because Trump ended the fine. That was a big problem, but nobody talked about it. Everybody said, well, you're the person who couldn't afford it and you're getting it for free. Congratulations. And nobody said, well, you're the person who can't afford it, but you are being forced to pay for it. Nobody interviewed people like us. You didn't see the individual mandate because they knew that it was the failure of the Affordable Health Care Act. If the individual mandate fails, the Affordable Health Care Act fails because these people were the ones that were paying for everybody else. But what we all did, because we're all self-employed, is we move our businesses to states that have exemptions. We read the exemptions, we comply with the exemptions, so we don't have to pay. And I never paid. I didn't pay once. And the fines were not high enough. It was only like $300 a year. They were not high enough to make me want to pay $300 a month. So I never paid. I have been to the hospital, I believe, twice in my life. When I was in high school and after an accident that I had. And I paid, the first one was paid by my parents. The second one I paid cash. I believed it was around $2,000. You know what? There was a time in college I went to the hospital. It was really quick in and out. And maybe I paid a couple $100 for the emergency. But other than that, I didn't go to the hospital. I don't have health emergencies. I'm not someone who needs health care, and I'm healthy enough that I don't have emergencies with the hospital. I don't take pills. You know, all these things. I don't go to get a checkup for a guy to hit my knee with a hammer and tell me I don't see anything wrong with you. So, well, I could have hit my own knee with a hammer. So there's a lot of people in the individual mandate that did not participate. And for example, in Hawaii, what they determined was that they said, oh, people who have the money are going to pay. They're not going to take the free option or the cheaper option. Well, that's not what happened. The people who had the money took the cheaper option or the free option, and the system failed. And it fails in the Affordable Health Care Act, the same thing. If people have the option of a way out, they're going to take the way out, and that's what they are doing. And that's why the system is not going to work. The other problem with the Affordable Health Care Act is that it was when politicians create something, they want it to work as long as they're in office. Once they're out of office, if it's going to fail, they make sure it fails after they're out of office. So what Obama did, I think it was 10 years, while he's in office, they're going to fund it completely. But after that, no longer funded by the federal government. The states have to pay for it themselves, which means they have to raise taxes because they're not going to have the budgets to pay for it. Where's the money going to come from? And that time is approaching, if it hasn't already approached. After that time, the funding is gone, which means higher taxes at the state level in order to comply, because they have to comply. Now, the other reason why I didn't like the Affordable Health Care Act is because we had an existing system, which was Medicare, and I've known lots of people on Medicare. They all love it. There's not a single person who is on Medicare who says, I wish I didn't have Medicare. Nobody says that. Everybody talks about Medicare like it's their lifeblood. They always want more money, but nobody says get rid of it. Nobody said get rid of it. Nobody says replace it with capitalism or anything else. The Affordable Health Care Act ended Medicare. It gutted Medicare. The Medicare solution was a nonprofit solution run by the government that worked and people were mostly happy with. The Affordable Health Care option is a for-profit option that's not run by the government. The for-profit solution is going to be more expensive than the nonprofit solution. That's another huge problem with the Affordable Health Care Act and why you were lied to. This sort of thing should have been a big, the media should have been all over it. There's many other things in the Affordable Health Care Act. I believe that the legislators signed it without reading it. It was handed to them 10 minutes before they signed it, before they voted on it, and they just voted on it, and that's it. And no Republican voted on it, is my understanding. And when no Republican votes on it, that means that one party is imposing its will on another party. They're imposing their will on another group of people, which is what fascism is. And when one party does it because they're in power, well, eventually the other party is going to be in power, and they're going to dismantle it. And then you have the bipolar status of the way the government operates, where someone builds something, the other one tears it down. What they should have done is agreed on something, built it together, something that everybody agreed on, and then done it. Republicans want good health care. To say that they don't is a lie. Nobody likes paying the health care costs. Nobody likes some of the requirements. You're paying for services that you're never going to get. I pay for perhaps lung cancer, even though I may never get lung cancer. You can't get all the diseases that you're covered for. It's not going to happen. Statistically, you're not going to get all these diseases that you're paying for. The other big problem, the reason why it's a fraud, is because they say they say that healthcare is, we're in a capitalist country, and so you say, oh well, we're in a capitalist country, so healthcare is capitalist. No, it isn't. Healthcare is highly, highly regulated. Software development is not regulated. Healthcare is. It's regulated to the point where it reduces competition. Markets are protected. It's market protection that is not capitalism. The states enact laws to make it difficult for new companies to enter the market. And what happens is you got a company that's a healthcare company, and they're powerful. They help somebody get elected. They say, we want you to pass these laws. They pass the laws, and then they have a monopoly in that state. And then you can't buy from another state because your state doesn't let you, or because that company doesn't operate in your state. It's not capitalism. It's not free market. It's protectionism. It falls under socialism, fascism, communism. It falls under that form of government. It doesn't fall under free market capitalism. And what they did was they took a system that was broken because it wasn't free market, and they made it more broken. It was not free market that you didn't have to buy, and now it's not free market that you do have to buy. And that is not fixing the system. It's taking a broken system and making it worse. I have heard that they have more employees to do with billing than patients, because different healthcare companies have different standards of practice for billing. Now, this is not a difficult problem to solve. You make standardized billing, and that's it. And everybody complies with standardized billing. Everybody does it. You cut the expenses of the staff at the hospital. You cut the cost of healthcare, and it's cheaper. You reduce the barriers buying across state lines. You reduce laws that prevent competition, prevent people from entering your market. Whenever I searched for healthcare, I only would find one or two companies. It was always crazy amounts of money, and there's so many companies out there, and I was never eligible for enough to get a good deal. In terms of pre-existing conditions, which people have a lot of complaints about, that's not health insurance. Insurance is risk-based, with the implication, with the perception that you currently have no risk. That you have no liability. A person who has a pre-existing condition has a liability. So you don't get insured when you have an existing liability or an existing condition. The solution is not to force healthcare companies to cover you if you have a pre-existing condition. The solution is to have a different type of program that is not health insurance, that is a healthcare program, to cover people with pre-existing conditions, where they are separate from the rest of the population. One thing that could have been done is to have government-run programs, government hospitals, that provides services. Most people aren't worried about breaking a leg and going to the hospital. They're worried about getting cancer and having $1 million bill that they're never going to pay. Have the government set up services for those multi-million-dollar diseases that nobody can afford, and provide it for free. You get on the waiting list like every other socialist country with socialized medicine. And when you have cancer, you fly to wherever the nearest location is. You stay at a hotel. You stay in the hospital for your treatment. And you go home, and you pay a couple $100s for your tickets because you're going to put it in a centrally located area everybody can access cheaply. It's low cost to you. You get great cancer treatment. You don't go every day for cancer treatment. That's what I would have done. Don't tear down the whole system and penalize and punish everybody because some people have a problem. People with pre-existing conditions should have had a different program that doesn't penalize everyone. And that program would have been good for them. And you wouldn't have the death panel. You wouldn't have the panel of people that can say, no, you don't get the treatment for any reason which they choose. The Affordable Health Care Act says that they can deny you treatment for any reason. It doesn't say that they can deny it for you based on a doctor's recommendation. And that's a part of the fraud from the Affordable Health Care Act.